Good day. So today I am going to assess the thorax and lungs. In this assessment, the posterior and anterior thorax will be included. The equipment that will be needed in this assessment is stethoscope. Good day, ma'am. I am Rika and I am your nurse for today. So may I know your name and age?
I am Kate Hannah Calabia Benicio and I am 18 years old.
Okay, so ma'am Kate, today I will be assessing your thorax and lungs. Is that okay with you?
Yes.
Okay, so I am expecting your full cooperation in this assessment. Before I start, I will sanitize my hand to prevent the transmission of microorganisms. And I will also provide privacy for you so that you will feel safe and comfortable. And now I am inspecting the client's position, posture, and the ability to support her body weight. And next, ma'am, do you feel comfortable in this position or do you want to stand up for you to breathe comfortably?
No, it's okay. I'm fine.
Okay, so as I can see, her anterior thorax is fine. And ma'am, may I see your posterior or your back? Okay, so I can see that her spine is fine and there is no presence of abnormalities like people with scoliosis or the sideways of curvature in the spine. Also, the movements of her accessory muscle are also normal as she breathes. Next, I will move to the posterior thorax and lungs. I will observe her skin and posture, and as I can see, my patient has a presence of back knee and I cannot see any scars that came from accidents or trauma. Next, I will palpate her spinous process or the spinous processes. So I can feel that it is evenly spaced and non-tender. After that, I will assess her respiratory expansion. And in doing that, I will place my hand on her posterior chest wall, which is right here. And with my thumbs at the level of the thoracic 10 or the T10. And I will press it together with a small skin fold. And I will observe the movement of my thumbs as she takes a deep breath. So, ma'am, can you please take a deep breath? Okay, so my thumb moves together as she breathes in and as she breathes out. So, it is normal. Next, I will palpate her fremitus by placing the ball of my hand and I will assess the corresponding areas for symmetry and vibration. So, ma'am, whenever I move my hands in different parts of your body, you have to say 99, okay?
Okay.
Game.
99, 99, 99, 99, 99, 99, 99, 99.
Okay. Then next, I will percuss the resonance and I will start from the apices of her scapula and across the top of her shoulders through the intercostal spaces and across down until the lateral aspects of the bases of the lungs. And I will compare the two sides. Okay. So, the both sides are symmetrical and the vibration are the same on both sides and so it is normal. And lastly, I will auscultate her posterior thorax as she slowly and deeply breathes through her mouth. So, ma'am, can you please, wait. Can you breathe slowly for me? Okay, so the sounds of her lungs is normal, so um, it is fine and there is no some abnormalities in her lungs. So now we will move to the anterior thorax and lungs. I will begin with the bones and the muscles for the traction and accessory muscle which is used for normal breathing. So right now I will palpate for the anterior chest. Then next, I will observe the respiratory expansion just like what we did in the posterior thorax. I will place my hand on her anterior chest wall and my thumb will be pointed towards the sepoid process and I will press together a small skin fold. So ma'am, can you please breathe deeply? Okay, so as I have observed, my thumbs move together as she breathes in deeply, as she breathes in and out. So it is normal. Now I will percuss the anterior thorax. I will start just above the clavicle down the chest wall from side to side. From side to side. So the sound and the vibration is symmetrical, so it is normal. Next, I will auscultate the apical pulse while she is in supine position for 1 full minute. Okay, so her pulse rate is 73 beats per minute. Now I am going to auscultate the aortic, tricuspid, and mitral for the heart sounds. I I didn't hear any murmuring sound in her heart, so it is normal. And right now, I will auscultate the anterior chest with the diaphragm of the stethoscope. I also didn't hear any abnormal sounds in her lungs, so it is normal. And after doing all those assessments, I will document the findings so that I will document the findings for legal purposes. So this wraps up the thorax and lungs assessment. Thank you and God bless. So lastly, I will document all the findings for legal purposes. And this wraps up the thorax and lung assessment. Thank you and God bless.